Let's bring in the Doctors Union Secretary General, Dr. Chibanzi Mwachonda. He is the Secretary General of the Kenya Medical Practitioners Dentist Union. Dr. Good morning.
Good morning, Eric. How are you?
Very well, thank you. How are you doing?
Niko Salama.
So we will go straight into the conversation that you've heard what we're talking about. We're talking about vaccines, and as we wait for you to be able to join us on video as well, there's a lot of disquiet among healthcare workers over a number of things surrounding the vaccine. What is this all about?
I think first and foremost is to say that it's a good thing and it's a great thing that our country is among the few countries that have been able to have access to this COVID-19 vaccine through the COVAX alliance.
Yes.
I think the only issue that perhaps you've had amongst the healthcare workers is that they did not feel involved.
Mm-hmm.
And feel involved in the sense that, yes, we knew a vaccine was coming, right, from last year. Mm-hmm. The sensitivity, and I heard how you were discussing this, and I totally agree with you with that. Like, for someone like me, I do understand what a vaccine is, I do understand how a vaccine works.
Yeah.
That. But let us also remember that this is a novel vaccine.
Mm-hmm.
And healthcare workers are equally reading a lot around this vaccine.
Yeah.
So there are certain adverse effects that come with the vaccine that a number of the healthcare workers are hesitant about, because questions arise. If I do get certain adverse effects, you're supposed to perhaps get mild symptoms, but what happens to get the severe symptoms?
Mm-hmm.
You see, and these questions are not just in Kenya, but it's global. In fact, the US is having a very big problem of vaccine hesitancy amongst doctors and other healthcare workers. The WHO has actually set up has agreed to set up a compensation fund for those who get serious adverse effects of the COVID-19 vaccine through the AstraZeneca, through the COVAX facility. So these are the concerns that are there. And then the second thing, of course, was there wasn't adequate communication. Before the vaccine got here, where you're getting vaccinated, how is the whole program going to be rolled out? If you read the National Deployment Plan for Vaccines from the Ministry of Health, it is very elaborate on how they're going to roll it out, how they're going to engage healthcare workers, how they're going to educate perhaps those who need education, how they're going to carry out the awareness campaigns. All that did not happen. See, so the vaccine lands last week, pop, and calls are coming. Come, get vaccinated. You get I hope you get what I'm saying. And that's where now the challenge becomes.
How would it have been different, Dr. How would it have been different? So are we looking at a reluctance here, or are we just saying, okay, people are in limbo because they don't really know what to do? So now that the counties are rolling this out and they're saying, actually, come and get vaccinated, are we seeing a problem there? I can understand that there was a need for proper communication and in terms of a plan of how this was supposed to be done. But now that we have counties talking about come and get this done, what's the challenge in actually going and getting it done?
Well, as I said earlier, and let me also be very clear that as KPMDU and as the doctors, we do support the rollout of the vaccine. But as I said earlier, where we are now, it's not all lost. I think the most important thing is getting to engage the healthcare workers in the facilities. We always have what you call continuous medical education, CMEs. Let them be talked to, let them be explained to, and let them know that if you do get certain adverse effects, this is how you're going to progress. You're going to get care at this point. Should you get adverse effects and you need hospitalization, then it means that your cost of care out of this vaccine, of treatment and all that, is going to be catered for. Because you're coming from a point where healthcare workers, remember, are on the front line, and we've had very, very, very horrid experiences of getting COVID and not getting treatment, access to treatment, and all that. So some of the issues are still there. So if you're going to roll the vaccine and let the healthcare workers again go through the same experiences, that's where you're going to have a problem. So as it is now, there's a lot of engagement with the healthcare workers. It's not because they don't know what the vaccine is. Remember, the others who have also heard were talking of preferring a different vaccine, and not what is available locally. So that discussion needs to happen with healthcare workers. We cannot just assume that we'll command them like sheep and they will go. I know healthcare workers myself. Yeah, and that's why I come out and I say, let us engage them, let us talk to them, and get that buy-in.
I'm sorry, I'm still stuck on this, Dr. What exactly is it that needs to be said to them because now that it seems that a few steps have been jumped, and which is understandable, but what now would health workers want to hear that would make them be encouraged then to go ahead and get this? Because we talked about frontline health workers are involved, security agencies involved, as well as teachers. Okay, so what message then needs to be given to healthcare workers to say, okay, fine, we're on board with this, let's go? What needs to be said?
I think for the healthcare workers, there's need for a lot of assurance on that issue of adverse effects, monitoring, reporting, and eventual treatment for if you do get any form of adverse effect that requires comprehensive treatment. I think that, to me, that is the most important thing that I see that needs for the healthcare workers to be doing. And of course, the fact that then it's very clear that this is how we're rolling it out. That very simple things for me, from where I sit, that will get them on board.
What would that then be? I mean, if you develop any adverse effects or side effects after the vaccination, you'll be taken to hospital. Are you talking about whether you'll be covered, whether there'll be a medical cover for this, or are you asking whether there is capacity to deal with that?
Yeah, so let's look at our COVID situation. Already we've seen, if you go to the extreme end of your COVID situation, of those with severe symptoms, the ICU capacity is getting full. Not full really, but it's already getting there. So the experience is what I was talking about, that for those who experience adverse effects, last year there was this push and pull. Can we even have healthcare facilities, rather space for the healthcare workers once they get COVID-19 and they need treatment? So these concerns are still there. These concerns are still there. They were dismissed somehow, but these concerns are still there. And so these are concerns that need to be dealt with. If you look at treatment, fine, we have NHIF, but we still have the same issues of non-remittance in some-counties. And so then you're telling people who, if you get a disease, yes, you'll get treated, but this is how you get treated through NHIF, but then they're already dealing with, in some counties, dealing with situations where the cover is not running, it's not active. So these are and this is what I'm saying, that the vaccine might be unrelated to the issue that healthcare workers have, if you look at it from that angle, but it is also directly linked.
But I think at the same time, Dr. you guys are introducing the union politics into the issue of vaccination, because now when you bring in, what happens when an ordinary citizen, a police officer, for example, develops the same effects? What happens if a 50-year-old and above develops the same effects, the side effects? That question the way it appears, the way you're framing it, is you're still pushing for the plight of your union members, as opposed to saying, okay, as a country, we are rolling out the vaccination. We know that this is a novel vaccine. We don't know how it may react to the people. If it reacts, this is what we propose should happen to anyone, whether you're a doctor, a police officer, a cleaner in a hospital, an elderly person, any member of the public. But when you bring it to say, then, doctors, we are hesitant. The doctor hesitancy is because we don't know whether we are going to get our dues or whether we're going to get our position in a public hospital. That sounds very selfish.
Eric, I've heard you. And I like what you said, that what happens to the police officer, what happens to the teacher if they get adverse effects, where do they go? Where I was coming from was basically discussing it from a point of the people that I represent. But that is a general talk out there. Police might not say it because perhaps they don't have the voice like us through unions to say it. I hope you do get me. The elderly might not be able to say it because they don't have that voice that will actually air these concerns.
Okay.
And let me be very clear. There's no politics here. I think we live in a country where you should not ask questions. And that's what I'm finding very difficult in this country nowadays, where you should not ask any questions. Just do what is there. This is being done. Just move. And for me, and that's why I say, if healthcare workers associations, unions had this discussion in the ministry, even before the vaccine landed in our country, we will not be hearing all these sentiments.
What proactive
I'm
steps?
not scared. I'm not scared of taking this vaccine.
What proactive steps, Terry?
Let me just finish. If anything, I am willing to go out and engage the community on why we need this vaccine. As KPMDU, we are willing to do that.
Mm-hmm.
Yeah, we are willing to actually engage communities, have engagement with the communities, and explain to them what the vaccine means, why there is need for vaccination.
And so my question is, what proactive steps have you taken to engage with A, the Ministry of Health, and B, the team that is managing the vaccine rollout led by Akwale? Have you made any effort to reach out to them to say, here is our proposal? We have read the rollout plan and we see these are the gaps that maybe need to be addressed, and this is what we propose should happen.
Well, the engagement was just once when the vaccine was about to land into the country. Remember, initially we were not sure when it was coming, but by last week, those are some of the engagements you actually initiated, and where we are, as I said earlier, that we are actually willing to engage the communities on this matter, just to make sure that we have vaccine uptake in the country.
Mm-hmm.
Yeah.
Okay. So now here we are, Dr. And again, I'm going to ask, we're moving forward, right? We're going into a time where nobody else can get this vaccine until this group of people does in this country. And nobody else will get it until this first cohort of people is sorted out. What kind of assurance can we get to know that, this first round will go through successfully before any, arrangements for new ones are coming in? Granted, the debate or the engagement did not happen before they got here. Now they are here. And in terms of engagement right now, it's looking quite dicey in terms of how that's going to happen. How realistically do you think a conversation can be had about the safety or adverse effects of a vaccine that is already here and they're already asking a group of people to go ahead and take it? Do you really see that happening? And how can people be assured that they can get on the line if the first group of people still kind of, it's not happening?
What I see is your ambassadors must be healthcare workers, the frontline workers, including the security, including many things. The first group of frontline workers, because these are supposed to be the advocates for the rollout across the country to the general public.
Mm-hmm.
And the issues that are being, perhaps the concerns and the mamas that are coming out are not complex issues. If we do, like in the counties, what I've seen, as it's being rolled out, as I said earlier, in the facilities, before the rollout, the healthcare workers talks to and they have that assurance and they take the jab and then they come out and they must be facilitated now to engage the community. It has to be some form of campaign, vaccine campaign, get vaccinated, some form of campaign. Let the healthcare workers be facilitated. Not if perhaps we say union plays too much politics, so that's what is always being said. Let the healthcare workers, let my doctors go talk to Kenyans on the TV, on radio, and let them understand this and let them also engage the community. That's what I was saying. As KPMDU, we are actually willing to facilitate convenings with the community, the community health workers, perhaps, who have direct linkage to people of the community and some members of the public to just have this discussion about the vaccine. And I'm saying this, remember, because before the vaccine came, there was a very long period of false information, misconception, controversies about the vaccine. That has stuck in people's heads. You know? So you've had a long period of information that is false, that is full of controversy about this vaccine, or we want to exterminate the African people. So that information has permeated into people for the greater part of last year. And then come in the next year, this year in February, March, you're like, boom, here, have a vaccine. You will face that obstacle, and it must be seen from that angle.
Okay. There are some doctors who've said, okay, yes to the vaccine, but I want more information. For example, I want to know, when am I getting vaccinated? I also want to know, should I develop severe symptoms or any adverse effects after getting vaccinated? Then what happens? And we've raised these issues actually before in terms of the communication plan. So yes, the plan on how the rollout was going to happen was very good. Was there an accompanying communication strategy that said, this is how information will be given to the people? The key stakeholders. Who are the first stakeholders? First stakeholders are the first people who are going to get vaccinated. Then we also have the general public. To deal with all that, to remove the rumor that has been circulated in the community about what vaccine is likely to do, what this particular vaccine has, we need to have had a proper communication. And now if we haven't gotten there, then that's why you then see maybe doctors coming out to say, okay, I want to be vaccinated, but I have some questions. I want to be vaccinated. And the next, after I get vaccinated, I'll now start participating in vaccinating others.
Sure.
And they will come to me with those questions. So what am I going to tell them? That's why we're having a conversation with Dr. Chibanzi Mwachonda, Secretary General of KPMDU. He's now been able to join us on video as well. Dr. it's good to see you as we continue with this conversation.
Yes, Eric.
So, if we were to go by what you were saying earlier, the thing is KPMDU officially is all for vaccination. KPMDU has not said no to vaccination.
Very much so. We have not said no to vaccination. We have said our members should get vaccinated. But the concerns that are coming out of our members also need just to be addressed, and they are not complex issues. And let me be very clear, because I've already seen that angle of saying union politics. There is no union politics here. You're talking about people's lives. You're talking about vaccination. You're talking about a situation that has valid concerns. I think one of the things that I also wanted, and I was saying, was that looking at what happened in South Africa, where you had the variant of the COVID virus, and the AstraZeneca becoming ineffective. The variant is also with us in the country. So you have these concerns, and these concerns are very valid based on what is happening in other countries, what are the experiences. So I think just to be clear is that we are not opposing the vaccine as KPMDU. All you're saying is, yes, let's get people vaccinated, but let's also provide them with as much information. Let us also get them actively involved in this process. And if they do, they'll be your ambassadors, A good example of which we kept saying and we kept trying to engage initially was the universal healthcare plan, where we said the ambassadors to UNC will be the healthcare workers if you involve them fully, if you let them participate fully. And it's the same thing we're seeing here. So basically, there's nothing complex about this matter. I think if we sit and we all agree on how we are rolling it out together, and we are moving around it, we are moving out to engage the communities, it will be a very, very, very seamless process.
Have there been calls for this? I mean, I know it shouldn't have to be, but with what we are faced with currently, have there then been calls to those people and departments concerned to say it is necessary for us to have a sit down and you share this information with us, regardless of whether the vaccines are here or not? It's not too late.
With the government, they don't come out proactively to tell us. So there is your answer.
And that's the point that has to, and that's the point I'm also trying to make here. That let us engage the public. I mean, we have very many ways. You have media, you have social media, you have communities that can be engaged small ways of just engaging the community and letting them know that, okay, fine, this is the vaccine, this is what we anticipate, this is the rollout plan. And let us also be honest with Kenyans that it's a way to get vaccinated, the greater public, perhaps towards end of the year. Let them know that. So that gives you a lot of time between now and end of the year to filter out the concerns, to have those discussions with them. That by the time it lands here, we do not find ourselves in a similar situation that you're finding ourselves now with other frontline workers.
Okay, so do you think that this information will be shared? Do you think that there will be this engagement? I mean, you talk about plans to say, okay, by the end of this week, we're going to stretch out a hand and say, please tell us what's going on. Let's engage in this manner. Do you think the information will be shared? One. Two, do you think then also it could pave the way for future sharing of information, that whereby you see, it could be that Ministry of Health and others feel overwhelmed by the current situation, and that's why they felt, okay, maybe we've not had time to sit and engage. So then maybe taking a proactive role, even now and in the future, do you think that as this information comes out, then we will go towards a smoother transition? Because hopefully in the next year, more and more Kenyans would have been vaccinated, all based on this information. So do you see that happening?
Well, it's not purely up to me, but I think the ministry needs to listen. Because I can tell you for a fact, end of this week, you're going to see the civil society groups coming up requesting for information on vaccine. I've already seen it. It's something that has already been planned. You see, and I'm aware. So when the civil society starts coming out that way, then it actually rises the profile of the discussion in the public, and perhaps they'll say, I don't know how much they've engaged the ministry in their own way trying to get this information, because if they have and the ministry hasn't really engaged them or brought them on board, then it's going to create a very difficult scenario for the vaccine uptake in the greater public. And to me, that's the point of entry. You have civil society groups that are asking, you have human rights groups. Whether you like them or not, they represent people and they must be involved in this discussion, and they must have this discussion and be passed on with all this information that they're asking, because they're asking on behalf of the greater public. And once that is done, it becomes a very seamless process for me. But if we look at, we are government, this is just people who are making noise, we will not get anywhere.
Dr. Chibanzi Mwachonda, thank you very much for joining us this morning, talking about vaccine rollout of the vaccination in the country and what's happening and the hesitancy that we see in various sectors of the population. Asante sana for speaking to us. We'll hope to speak to you again soon.
Thank you very much.
Thanks, Doc.
Always a pleasure indeed.